I can't pinpoint exactly when my first symptom of MS started. I trace it back to about 2001. So I was 20 and I was loving life and full of energy, and all of a sudden my vision blurred, and over about a week or two it got intense and I lost vision in one eye. That prompted me to go to a doctor who sent me to an eye doctor who sent me to the hospital, and they treated me with a 3-day course of intravenous steroids, and everything went back to normal and I didn't think about it again until 2006 when I had paralysis in my face. Again, they treated me with steroids, everything went back to normal. 6 months later I got married, never thought of it again until 2014 when I relapsed, and my latest big relapse was in 2015 when I had a little bit of paralysis in my legs and was unable to walk properly. When I was first diagnosed, I had myself in a wheelchair in 12 months and I was ready just to give up. But then I look at my kids who are 10 and 7 and I need to set an example for them. So if they see me throw my hands up in the air and say, oh, it's too hard, I've been thrown this challenge, I'm just going to give up. I'm not setting an example for them when they're thrown a challenge in their life. I definitely try to manage my symptoms. I don't like anything stopping me from doing anything. I'm a little bit of a go-getter. So I don't like MS to define me, or MS to make me feel like it's come into my life and I allow it the time it needs and I give it the attention it needs when it needs it, but I definitely don't let it run things, because I think that's me giving in, and I won't do that. I'll try not to do that for as long as I possibly can. When I was first diagnosed, I remember my neurologist asked me if I had a hobby, and I said, yeah, I do my kids. And he said, that's not a hobby. And I said, my work. And he said, that's not a hobby. So I've just started playing soccer and I'm finding that as I'm running around the field, my vision will blur and I'll have to come off and have a rest. Once I cool down, my vision returns and I can go back on and keep running. That's something that affects day to day, because on a hot day, you can't really avoid the heat unless you're stuck inside in an air conditioner or in the pool, in and out of the pool in the air conditioner. So that's something that is tough on hot days in summer, and then on the reverse side in winter. Like I said, I work and I travel to work, so I'm out in the cold, and sometimes I feel like it's a bit difficult to work, which then counteracts with the nerve damage in my feet. When they get cold, that pain's a little bit more extreme as well. So it's just the day-to-day things that, again, people can't see them, but I can feel them, and they do affect me. So I just have to learn to move on with it. The reason I became an ambassador was to help educate people on what MS is and the reality of the disease. When I was first diagnosed, I had somebody ask me how long it would be until I was in a wheelchair. And it threw me a little bit, because I'm like, well, that's not the reality of the disease. It doesn't always end that way. So then that got me wanting to teach people that it's not always like that. That's not always the end. For all the women out there who also live with MS day to day, know that we're all in this together, and we should stick together and celebrate the MS Sisterhood that we've, I guess, created. It's important to talk and to encourage each other and be there for each other. So #MS Sisterhood.